Hello, my name is Terry Kirkpatrick, and I'll be your knowledge translator or broker today. Welcome to the Cole's Notes of Ethics Codes. I understand for our American audience that you may know Cole's Notes better by a local title, Cliff's Notes. How do I know that? National Lampoon. Have you ever seen a statement something like the following? I'll let you read those for yourselves. Good luck with that. If you haven't seen statements like this, not to worry. But if you have seen them, it means you've taken an ethics course or are a professional caregiver bound by a professional organization's code of conduct or ethics code. You may have statements like this in your organization, the one that pays you, or you may recognize these statements from a long and somewhat complicated document I wrote for DSWs and PSWs, which I published for one of my past organizations and offered free of charge to the Personal Support Network of Ontario and others. It's downloadable from my website at http://sites.google.com/site/mterrykirkpatrick, all one word. When you get there, look for Clients on your left-hand side, then Resources, and then scroll down through the various things you can download from there to find DSW and PSW ethics.pdf. Here's that site again. For those of you who were scrambling to write it down, it makes it a little easier to see it perhaps. The three examples that you saw earlier are from among more than 150 statements. These are organized in two broad general headings, one of them duty to the persons being supported, and the other duty to the employer, other professionals, and society. Needless to say, it gets a little complicated. Some of you might be thinking the ethics code doesn't help at all, it only makes it even more confusing for you as to what you should do or not do in the course of your work with someone who by definition is somewhat dependent upon you and for whom you have a duty of care. It seems to me that it shouldn't matter how complicated and detailed an ethics code might be in guiding your ethical behavior. It isn't a how-to book anyway, and should only serve as a reference to which you might look when you're not so sure about what's the right thing to do. In the middle of interacting with someone to whom you owe a duty of care, you don't have time to look up the proper section of the code and see what the right answer is. After interacting with a person you support, when there might be more time, say, in a review, the ethics code may be very helpful in clarifying a confusing issue, sorting out a dilemma, or even helping you or your supervisor correct or develop a procedure. I would agree that you can't act ethically by following, quote, unquote, a written code. There's too much to read and too many what-ifs to consider. You can only act ethically by considering your actions, consulting others as appropriate, listening to others with more and different experience, and focusing on the priorities in the situation at hand. I will argue, though, that a written code can help to form the basis of evaluation of actions, can help to focus the discussion on principles that might be involved, and can help to keep fueling discussion on ethical principles, an earmark of excellence in organizations' human services. Thus, it's an excellent reference document. Anyway, my point here is this. Let's try to make this simple without compromising the importance of ethics in your behavior towards others, and without throwing an ethics code out the window entirely. Download it and consult it, but don't think it will guide your behavior proactively, even if you memorize the code word for word. I have to give ample credit here to both Canadian and American associations of social workers, psychologists, speech pathologists, occupational therapists, and others who publish their ethics codes. I lifted a number of statements from these excellent efforts, modifying some for the positions that we call, at least in Ontario, Canada, Personal Support Workers, PSWs, Developmental Service Workers, DSWs, These are the certified terms that come with a college diploma testifying to their authenticity in our province. Other similar certifications in healthcare include healthcare aides, healthcare attendants, continuing care assistant, personal care attendant, home support worker, resident care worker, healthcare assistant, nursing assistant, and so on. If you're not Canadian or Ontarian, I forgive you. You probably have your own state or federal terminology from legislation for these types of occupations. So, here's my Coles Notes, okay, Cliff's Notes, version of all the ethics codes I have ever seen. There are essentially 3 main directions from all codes of ethics in personal care. All ethical codes, in my opinion, boil down to 3 basic ideas. Now, these ideas are hierarchical in nature. That is, the first principle wins over the second principle, and the second principle wins over the third principle. Something that offends the third principle cannot dictate behavior that offends the first principle. You get what I mean, right? I hope so. Anyway, first principle, the most important one, and the one that should never be offended against. Do no harm. The road to hell is paved with good intentions, but this is one that if we observe very carefully, we would do much better. We'll slide over to what harm is in subsequent slides. Right now, I just want to give you the overview first. Okay, ready for number 2. The second principle, do good. This is both an ethical commandment and a contract obligation that's inherent in our work, whether it's voluntary or paid. It is not a no-brainer. We'll slide over to a bit more on doing good in subsequent slides. I just want to finish giving you the overview. Okay, ready for the last one? The third principle, quality control. Strive to improve every day. Maintain at least an appropriate minimum level of quality. Attempt to continuously improve quality. Don't rest on your laurels. This principle is based on the understanding that time changes things. One must keep up with the times. One must refresh one's knowledge over time. One must keep one's ear to the ground. The people we support do not stand still. The earth doesn't stand still. And we can't take a snapshot of ourselves at the point of graduation and make that work for a whole career. An important thing to keep in the back of your mind throughout this whole session is that the work we do has potential for commission of acts, but also omissions that also need to be considered when we're judging ethics. So it's not only the donut we need to visualize, but also the whole, okay? What is harm? Harm by commission is the easiest to determine. Harm by omission is not so easy sometimes. Harm is measured by whether an act or omission brings death, disability, pain and suffering, loss of ability or freedom, or potential loss of a pleasure that we expect is enjoyed by most people. Although this last one does not include taking illegal drugs, visiting prostitutes, etc. But it does include being able to eat through the mouth so that the taste buds are stimulated, bringing pleasure. It's arguable that the degree of harm must be balanced against the degree of benefit, see the second principle, while others insist that if an act brings one of the above harms, no benefit could trump it unless specifically consented to by the person to whom it applies, who must be competent in the eyes of the law to appreciate the consequences, risks, and benefits. Although we tend to focus more often and somewhat dogmatically on physical harm, because it's more easily observed, measured, and objectively verified, much data points to harms of the spirit and identity as much longer lasting and more profoundly hurtful. Abuse survivors often suggest that the bruises to the skin heal faster and easier than the bruises to the soul. In any case, they are all harms. Physical harm by commission, such as an assault. Physical harm by omission, such as neglect or negligence. Psychosocial harms by commission, harm to the identity of a person. Psychosocial harm by omission, disregard for the identity of a person. Spiritual harm by commission, assault on the meaning to which people attribute their life. Spiritual harm by omission, which is a disregard for that meaning. The people we support are to be considered at great risk of harm. Some of what we do protects them from that harm. That is one thing that we do by doing good. Some of what we do reduces barriers and obstacles, especially to the last of the harms, the pursuit of happiness, anything that does damage to that. That's also doing good. Most offenses against this principle come from one of the following. What we think is good for someone may not always be so, or at least others may not see it that way, including the person we support. We sometimes think only of the good we're doing and fail to consider any associated potential harm. And what is considered good is subject to wide swings in public, professional, and personal opinion over time and in different cultures and religions. We do good by providing physical aid to personal self-care, psychosocial aid to self-actualization, spiritual aid to develop and sustain meaning and well-being, removal of barriers to personal self-care, removal of barriers to self-actualization, and removal of barriers to living with meaning. Some of the most common ways in which people improve upon their practice need some discussion time here. So how does one continuously improve one's practice? Well, three biggies are reflect, invite, and consider feedback from consumers, families, supervisors, and peers. Some organizations do this formally by way of sending a survey to consumers and their family and others. Another way is to seek training in areas of importance or areas of low skill or experience. And it really is important to know yourself. So, for example, one of the supplemental slides I have for today, if we choose to go in that direction, talks about the Johari window, which is essentially the four quadrants of things that we all know, that is, that I know and that everyone else knows, things that I know but not everyone else knows, and that becomes a curriculum for teaching. Things that I don't know but everyone else does know, and that of course is then the curriculum for learning. And finally, things that none of us know, and that's that issue of what do we know what we don't know. And there are of course oblivious people around us all the time who don't know what they don't know. And if the rest of us don't know what we don't know, then that's a whole area for discovery. And constant improvement, of course, at least keeps us aiming for those areas that we may not know that we don't know yet. Anyway, more on that if we go into the supplemental slides. And finally, seek mentors, advisors, and seek knowledge. Some of the actual practical strategies that people use include education and training, formal. Now we've got the web. There's lots of different ways in which that takes place. Day-long workshops, courses taken at college, continuing ed, and the like. Supervision, so oversight, using consultants, resources, tools, checklists, a variety of ways in which people can self-monitor or be monitored in the performance of their duties. Professional associations, this is true very much of psychology, social work, occupational therapy, speech-language pathology. They all have professional associations, and many of those have ethics codes and even disciplinary bodies within them. A third set of strategies deals with knowledge translation and exchange. Some people refer to that as continuing education, but it does not need to be formal. And finally, peer support, or even groups like this one, the Frontline Connect community of practice, which we are forming because we think that there is a need for the ability to exchange information among members of the field. Fourth is just a sort of a self-awareness agenda, becoming increasingly and more effectively self-aware. Finally, communication, transparency, dialogue, and discovery. Some specific kind of decision-making strategies will help to prevent or inhibit the potential of harm. These include the least dangerous assumption, the least intrusive principle, and truly informed consent. The least dangerous assumption means that whenever possible, faced with two or more competing assumptions, pick the one that's least dangerous. This is especially relevant to competence, consent, and treatment intervention decisions. So if you're not sure that a person is capable or is giving a truly informed consent, then add the consent of a person who is supportive of that individual and who is not likely to be in a conflict of interest. The least intrusive principle means that one should make interventions in a person's life that are the least intrusive to their privacy, autonomy, and personal security or freedom to achieve the best overall results. Truly informed consent means that the person we are supporting or those without conflict of personal, professional, fiduciary, or any other interest who have a valid substitute consent order for the person we're supporting gives a fully informed consent to the practice, the intervention, or the decision. The best defense for alleged unethical treatment is truly informed consent. This means that options have been given, pluses and minuses, that is, consequences of the treatment, both positive and negative, risks and benefits, are described fully. The person's capacity, intellectually, communicatively, and emotionally, to fully give informed consent is considered, and even substitute consent has been added to ensure that a go-ahead is given to treatment before it is given. Those are good ways of making sure that you are acting ethically. Some strategies that help to prevent or inhibit the potential of harm also include clear documentation before the fact. Very important that it be written or completed before an intervention has occurred. Otherwise, you run the risk of being claimed to be making excuses or covering your tracks. Transparency and visibility can protect. I'll speak a bit more about that in a sec. Get informed consent from people without conflict of interest if the person's capacity is suspect for the person you're supporting. And don't act unilaterally if the opportunity for consultation is available. Clear documentation is an essential professional standard and provides what could be a potential defense for allegations of unethical treatment. Involvement of family or valid substitute consent givers should be obvious if there's any doubt about the person's capacity to give informed consent. Don't act unilaterally in an ethical dilemma if at all possible. At least get a second, truly independent opinion. That would be true even if you're a volunteer and don't have an immediate supervisor. Transparency is very helpful. By transparency, I mean literally anyone can look and see what you're doing, and if there are concerns, you're going to hear about them. On the other hand, be very wary of secrecy, and in our field we have this notion that confidentiality is a very important principle to observe. However, that can be used to cover inappropriate behavior, and often is, for that matter. So there is the potential of a lie. You know, and the lie is typically, we're observing confidentiality, when in fact what the people are doing is for their interest and not for the interest of the person being supported. Transparency confers some degree of protection against complaints. Documentation demonstrably written before an event is helpful and can guard against the perception of simply making excuses after the fact. And it's a mark of due diligence. Knowledge is power. Knowledge is protective. The more people generally who have knowledge of a thing, the less likely there is any hanky-panky going on. Now, we can stop here and go to our audience for discussion and dialogue, and I think it's probably a good idea to do that. If we have time for it, I can do 3 more slides. One on self-awareness by showing what's known as the Johari window, and we've sort of slightly discussed that already. The next on what's the makeup of psychological harm by omission or commission, in which I speak of 23 factors which have been discussed in the child welfare sector in particular, marking different forms of psychological harm. And the last one from Darcy Elk's work and Wolfensberger on the roadmap to abuse and maltreatment, up to and including his concept of death making. So your choice, audience. We can, as I say, stop here, and I have a separate thing I can call up a little later if we want to do those slides 13 to 15. So I'm going to slip now right to the summary. So, summing up, try to establish the highest principle most at stake, and remember that harm or a concept of harm as a principle trumps any notion of a concept of good, trumps any notion of an interest in quality control. So determine, if you can, what principles are actually in conflict. So you might have to do some analysis or some breaking down of the situation. Pick the action that satisfies the highest principle. Some weighting may be done, but remember that just because it's very important to do quality control does not actually enable you to then do something that maybe is a risk of harm. Choose the action that least offends the most important principle. And it could be any of these three. The most important one is always going to be harm, whether there's a chance of harm or whether there's a realistic prospect of harm. Will trump whether or not there's a real prospect of doing good, and that will trump whether there's a real prospect of improving the quality of the service, unless one can argue that by doing so you're also increasing good and reducing harm, in which case you don't have any conflict and there is no dilemma. Always practice due diligence, transparency, documentation. Make sure that you have really explicitly detailed what the dilemma actually consists of. And the last point is just kind of an editorial comment of mine. Only do nothing when it is the very best conscious choice to make. I find that a lot of people faced with complicated situations or ones in which ethics are complicated may have a temptation to do nothing. But that is a very important choice, and if by doing so you permit the possibility of harm, you have made an ethical error, and perhaps even a significant one. So doing nothing is not always, in fact it seldom is, a good choice, but occasionally it is the right choice to actually do nothing. So when I've boldly chosen action that might be considered questionable, after having considered all of the above and consulted with colleagues, I still say that I would rather act consciously and be judged by a jury of my peers than to fail to act and thereby contribute to a continuing harm. Generally speaking, around the issue of due diligence, it's almost never possible to know exactly what the right answer is. However, the fact that you have documented that you have consulted, considered, and ultimately decided consciously on an action based on something like an ethics code with the aid of a confederate whose interest is not only in agreeing with you, so for example a supervisor, a peer in another organization, a professional consultant, somebody who doesn't have to agree with you, it should be considerable protection against claims that you've acted irresponsibly. So that's it then. Thank you very much for participating in today's session, and I'm looking forward now to dialogue and debate and a good deal of interaction with you as an audience.